Healthcare workers and first responders may be first in line for the coronavirus vaccine, but an alarming number are refusing it. The LA Times reporting 40% of local firefighters failed to even show up at a vaccine drive last week. Fox News medical contributor Dr. Nicole Saphier is here to react. Doctor, thanks for being here. So obviously when you see stuff like this, I think it makes people nervous because they say to themselves, well, if medical professionals and first-line responders aren't getting it, do they know something we don't, and should I wait? What are your thoughts?
Of course, Jedediah, and I can understand why hearing some of these headlines may cause people some concern. And it's not just the LA firefighters. It's being seen all across the country where there are people opting not to receive the vaccine. And it's happening for a variety of reasons. Some people feel that they don't need it. They don't believe that they're high enough risk to either contracting it, or they don't believe that they would have severe illness if they got it. Others have some vaccine hesitancy. We know that that runs rampant throughout the United States due to some conspiracy theories that people are claiming that the research was rushed. There was a lot of politicization of the scientific process when it came to making these vaccines. And so, unfortunately, it has really muddied the waters, and it has had a very unfortunate result when it comes to vaccines. Now, I want to tell you, Jedediah, if you look at flu vaccines every year, about only 35 to 40% of American adults actually get the flu vaccine. And that's because a lot of healthcare workers are actually forced to get it if they work in healthcare setting. So we know that a far majority of adults don't actually get normal vaccines anyway. So COVID-19, I'm not surprised that people aren't getting it. However, Jedediah, here's my biggest concern. I think people have really normalized this virus and this infection because it's been going on for so long, and people have COVID fatigue, which we've talked about. But, Jedediah, people who get it say, they make the comment of, I still haven't gotten my sense of smell or taste back, and it's been several months. But let me tell you why that is so serious, Jedediah. Losing your sense of taste and smell, that's not just you're congested and you can't smell your coffee that morning. That means that your central nervous system has been affected by this virus. And long COVID syndrome, those symptoms that are lasting 3 months, 6 months, and even longer after that initial infection, those are becoming much more prominent in about 20% of people that test positive. I mean, that's a big deal, Jedediah. This virus is serious. We still have record-breaking people being hospitalized and dying every day. We have to take it serious. I'm not so interested in who's getting the vaccine, but how many people are getting the vaccine. And that's what we need to focus on getting this vaccine into as many arms of Americans as possible to reach that level of immunity so we can move on with our lives. Yeah, we know that a lot of the lingering symptoms for people involve lungs, but also, as you mentioned, neurological. I've heard a lot of that from a lot of people that got COVID 6, 7, 8 months ago. I want to just quickly, we don't have a lot of time, but quickly touch on something in New Jersey, which is that smokers can now get vaccinated before teachers and before public transit workers. That's causing a lot of controversy. We only have about 20 seconds, but can you tell us your thoughts on that? Again, Jedediah, at this point, we need to just open it up to everybody and anybody who wants the vaccines. Smoking, unfortunately, we have 34 million Americans still smoking cigarettes. It causes chronic illness and cancers. And if we want to keep our hospitals functioning, we actually do need to get the vaccine to those that are vulnerable, and people that smoke are. But again, I don't think it should be restricted to them. I think anybody that wants the vaccine, we need to try and get it to them as soon as possible.
Yeah. Dr. Nicole Saphier, thanks for being here as always.
Thank you.